In this video, I'm going to go over weight gain caused by psychiatric medications. Why does it happen? What medications cause this? And what can we do about to prevent the weight gain and to treat the weight gain if it's already there? Now, there are two main receptors that cause psychiatric medication-induced weight gain. One of them is the H1 receptor, the histamine receptor, and if you block that, that can cause weight gain. And also blocking a specific serotonin receptor called 5-HT2C. And both of these, or either of these, when they're blocked, they affect how full you feel in a certain part of the brain called the hypothalamus. Now that we know how it happens, what medications cause the most weight gain? Well, those include a few of the dopamine blockers, clozapine, olanzapine, risperidone, and quetiapine, also known as Seroquel, and an antidepressant medication called mirtazapine. Now, which medications cause a moderate amount of weight gain? Well, a few of them include two of the dopamine blockers, Abilify and brexpiprazole, also known as Rexulti, a few mood stabilizers, such as lithium, divalproex, gabapentin, and pregabalin, also known as Lyrica, all of the selective serotonin reuptake inhibitors other than fluoxetine or vilazodone, tricyclic antidepressants like amitriptyline or clomipramine, and two of the serotonin and norepinephrine reuptake inhibitors, duloxetine and venlafaxine, also known as Effexor. The good news is there are many psychiatric medications that are weight neutral, meaning they don't cause increase or decrease, or some psychiatric medications cause a bit of a decrease. An example of some of these include some of the dopamine blocking medications, such as asenapine, lorazepam, also known as Latuda, iloperidone, and ziprasidone, ADHD medications such as atomoxetine, and any of the stimulants like Adderall, Concerta, Vyvanse. The antidepressants that don't cause weight gain include bupropion, buspirone, fluoxetine, and a few others. And some of the mood stabilizers include lamotrigine and carbamazepine. So now we know why it happens and what medications cause this. So how do we treat this and how do we prevent psychiatric medication-induced weight gain? Well, it depends what medication is causing the weight gain. Let's start with the dopamine blocking medications like risperidone, quetiapine, clozapine, olanzapine. Well, the first treatment to prevent weight gain or to treat weight gain once it's already there is diet and exercise, making sure you're not drinking too many calories, making sure you're not eating too many calories, and to exercise to expend all that energy as much as possible. Now, if you're already doing that, there are some medications that we can consider. The first thing we might do is add metformin. For dopamine blocking weight gain, metformin causes about 6 pounds of weight loss. Another medication that can be used is naltrexone, which showed in studies to give about a 7.5 pounds weight loss when there's dopamine blockers being used. And this was compared to placebo, where people were taking a water pill, and instead of losing weight, they actually gained 3 pounds. A supplement that can be used together with dopamine blockers is alpha-lipoic acid. And this supplement showed over 12 weeks to have a 2.9 pound weight loss versus the placebo, where they gained 1.5 pounds. Now, there are also some evidence-based practices for serotonergic-induced weight gain, so medications that increase serotonin causing weight gain, like serotonin reuptake inhibitors, like paroxetine, Zoloft, escitalopram, and that class. A mood stabilizer called topiramate can be used. Bupropion can be added with or without naltrexone. One study over 24 weeks with just bupropion itself showed about a 7% to a 10% loss in body weight. Zonisamide, which can be used with or without bupropion, in a study of 60 patients showed about a 13-pound weight loss at 16 weeks and about a 20-pound weight loss at 32 weeks. Phentermine, which is a psychostimulant, can also be used and has a lot of research, about 9 randomized controlled trials that show an average weight loss of about 8 pounds over a variable time period, 2 to 24 weeks. And lastly, glucagon-like peptide 1, GLP-1 agonists like semaglutide and liraglutide. Semaglutide, also known as Ozempic, can also be used for weight loss. For semaglutide, at 68 weeks, about half of patients had lost 15% of their body weight, and a third of patients had lost about 20% of their body weight. So that one definitely works really well. And that is compared to placebo, where they only lost 2.4% of their body weight. Now, weight gain is one side effect of psychiatric medications. Sexual dysfunction is actually another one that happens very often, and you can learn all about that right here in this video.